emergency medicine physician, Dr. Jacob Sinkoff, and Henry Ford Jackson resident, Dr. Brandon Berka. Welcome to the show.
Good morning. Thanks.
Good morning.
Yeah, thanks for having us.
Yeah, how's it going so far? I know you've got the little ones going. Is it cold season yet?
Oh yeah. Full season. It's a little early, but yeah, it's starting around. Right now we haven't seen a ton of RSV or influenza. We're seeing COVID again. So it's kind of just a minor. We're seeing hand, foot, mouth a little bit.
Oh, really?
So a case of hand, foot, mouth.
That's my least favorite.
That's my least favorite, too.
Absolutely.
I don't like the name of it.
Yeah. You don't realize how much you use your hands and your feet until you get hand, foot, mouth, I think. Or eat. Yeah, it's like it gets all the good spots.
I don't like the name of shingles either.
There's a lot of names. Yeah.
Yeah. They make these unappealing.
There's a couple others. I don't even want to say them. I don't like them so
I'll
bad.
say it. Scurvy. Is that still a thing?
No, I haven't seen scurvy. Not that I know of, at least. But yeah, we're coming up on flu season too, so a reminder: get flu shots. And
So we have a resident with us today, and you don't actually live at the hospital.
No. Prior to previous belief, they actually let us have a little bit of a life now, which is nice. But so I've been a resident now for 3 years in Jackson. And basically it's a time where we get more training into our specialized field. A lot of the time we spend in the emergency department, but we also get to go and kind of explore other things. Like this month I'm on an EMS elective where I get to ride along with the paramedics. And it's cool to see everything that happens before patients get to the hospital, and you get to see patients in their own homes. So,
what's been the biggest learning curve moment for you over your residency?
Definitely probably the first couple of months.
Yeah.
It's a big transition from being a medical student and being involved and taking care of patients to really taking on that responsibility. Yeah. So the first couple of months you feel like you're drowning a little bit, but you have great people, other core residents, attendings like Dr. Sinkoff who help you through it. And with any job, as you keep doing it, you get better and you learn how to serve the people better too.
Are you on an emergency rotation right now, or is that where you want to be?
So I'm on the EMS rotation right now. Okay. So I'm on the ambulance, but next week I'll be back in the emergency department. Okay. But again, most of the time we spend in the ER. We just get to do a couple other things to kind of round you out well so that you can be the best doctor you can be.
Yeah. And that's what you want to do.
Yeah.
So Dr. Berka is in our emergency medicine program, which is a 4-year program. So we have him for another year, which is good. But sad to see whenever they graduate, we always try to hire people. Yeah. So we're actually starting our process this month about interviewing new people. So it's a never-ending cycle, right?
Yeah.
So we're starting to interview for positions to start July 1st ones.
And Brandon, you're from Michigan, correct?
Yeah, I grew up in Saginaw, so not too far away.
Do you want to stay in Michigan?
That's the plan.
Cool.
Yeah. My wife's from Holland, Michigan, so we want to stay in Michigan and serve the people in the community.
And we always try with they get an extra bonus point. We always obviously try to interview our candidates from Michigan, knowing that we train them really well. We want to keep them, either here in Jackson or if not, at least within the state. So, try to interview, recruit as many Michigan people but we take residents from all over the country.
I like to think we in Jackson show the residents a good time so they want to come back and work here. Have we shown you a good time?
Absolutely. Yeah. I've had a really good time here. I mean, it's a lot of work too, but then you have a lot of good times as well.
Yeah, and we've hired, I should add it up sometime, probably 10 former residents as attendings now. Yeah. Most work in Jackson. A lot of them work at our other, we work at emergency departments, IEP, throughout the state, but other sites too that our company staffs the emergency department. So it's a good recruitment tool.
I wanted to ask you guys about concussions, if you don't mind. I feel like I'm hearing about more and more concussions now more than ever. Is it just that we're more aware of it at this point and we're treating people for concussions?
That's probably a big component. You'll hear about it with any sort of medical diagnosis is, when there's increasing diagnosis, is it because of something that's changed, or is it just recognition now, which is causing this seeming increase in that? And I think there's probably a decent component that it's just better recognition, which is good. recognition and then treatment.
Sure.
Recurrent, head injuries don't occur too, and we're seeing that now with sports coming up, especially, or and ongoing, especially football. And we'll see patients in the emergency departments, and parents are very much more aware now. I've noticed about head injury symptoms, keeping children out of sports whenever they've had a head injury. And we have a great team with our sports medicine partners through Henry Ford, with programs about when they can return to sports, testing and everything like that. And I know the schools, the athletic trainers also do too, where they, to start the school, they fill out a questionnaire prior to the event, and then can compare. And so there's lots of data, and so I think probably it's better recognition, which is causing these increasing numbers.
Do you guys see athletes coming into the ER with their uniforms and shoulder pads and stuff still on from time to time?
Yeah, definitely. They come in with their helmet on, and their shoulder pads, and you try to save as much as you can, but obviously there are times where some things have to be cut just to make sure we're
I was like grimace when I'm cutting we're cutting the jersey, and the coach
Like,
coach is like, a little tear comes on the coach. I was like, sorry. It's like, I know you got to do it. But and it seems like it's definitely, I think I was talking about some expanding the days of the week. It seems like almost, Thursday through Sunday now.
Right.
We're playing.
Oh, yeah.
You remember high school football used to be Friday nights. You'd have freshman JV, then varsity. It sounds like.
We even have some teams that play Monday nights.
Well, between now and the end of the year, you can watch football on TV every single day. There's going to be between the NFL
if you want to watch
and
the South
college,
Alabama, East Arkansas.
every single day there's going to be.
Yep.
How often do people come into the ER with some sort of injury and they don't want to tell you what happened?
That's probably at least 50% of the time.
Really?
Yeah, we'll get a different story, and then later on, like at the end, you're like, oh, it was actually this. And you're like, well, now I have to order this extra test. But, we're always happy when people, no matter when it happens, when they share how it happens, but it is funny sometimes. You're like, I don't think that happened because of that.
And that's for all types of injuries or ailments, not just sports. There's a lot of times the backstory takes a while to dig out. So.
People are embarrassed to tell you what really happened.
Yes, absolutely. And people always say, oh, I'm so embarrassed. I was like, trust me, there's nothing that I ever heard before. You don't need to be embarrassed.
So you have to be detectives as well.
Yeah.
Nice. So falls, that's falls and fall. I don't know what it is, but I know
Wet
about
leaves.
three people that have had falls in the last few weeks. That's a common injury that people come into the ER with, isn't it?
Yeah, definitely with us being blessed with the 4 seasons, like you said, the wet leaves, and then after that, the snow and the ice will be upon us. So, definitely something that we see a lot and picks up here around this time.
You don't want to see these guys, but we appreciate you coming in and being on our show today.
Thanks
for having us.
Dr. Jacob Sinkoff and Dr. Brandon Berka. More of the morning show after this.